Hi, welcome to the second part of prescribing module. In this module, we will be focusing more on what is prescribing error and their examples. What is prescribing error? Prescribing error can be defined as incorrect drug selection, dose, quantity, route of administration, and indication. Prescribing a contraindicated drug is also considered as prescribing error. When a doctor prescribes a drug without having a good knowledge about the drug itself and the patient's details, it is also considered as prescribing error. According to the literature, there have been many reports on prescribing error. WHO has reported that around 50% of medicine were prescribed either incorrectly or irrationally. According to Hawk in 2020, prescribing error are considered as prescribing mistakes that happens through a weak or wrong prescribing choice or prescription inscription procedure. And according to a report by National Patient Safety Agency report in 2004 and Institute of Medicine report USA, medical errors cause a large number of deaths each year. In another report, medication errors cause 1 of 131 outpatient and 1 of 854 inpatient deaths. So based on the medical literature, we can see that prescribing error occurs in many countries and it resulted in death to patients. What are the contributing factors to prescribing error? The most common factor contributing to prescribing error is lack of knowledge of the prescribed drug. These usually occur to houseman doctors or interns who just started their career and may not be familiar with all the drugs in clinical practice. Secondly, due to inadequate or inaccurate medication history during history takings, this can contribute to the prescribing error. Thirdly, inadequate training, particularly at undergraduate levels and among freshly graduated medical officers, also have shown to contribute to prescribing error in clinical settings. Next, some doctors are unaware of patients' details. These include patients with comorbidities, pregnancy, health literacy, and cognitive function. And lastly, due to lack of experience and absence of self-awareness, some doctors are not aware of making error when prescribing a drug. Now, let's discuss further details about prescription errors. Prescription errors can be divided into error of omission and error of commission. So, what is the difference between these two? The error of omission is a prescription with missing essential information. What about error of commission? Well, it is a prescription with wrongly written information. So please know the difference between these two types of prescription error. Now let's learn common errors in prescribing drugs in clinical practice. Studies have shown that there are different types of errors committed by doctors in clinical settings. Example of errors would be illegible handwriting on the prescription sheet, incorrect drug selection, incorrect dose calculation, incorrect route of administration, incorrect frequency, and length of therapy. Apart from what I have mentioned just now, prescribing errors in clinical practice also include prescribing an allergic drug, deletion of previously used drugs, addition of drug not previously used, inadequate or incorrect instruction of the drug use, prescribing a drug which is unsuitable for patient's condition, and prescribing a drug with an incorrect indication. Do you know that doctors' poor handwriting, which are illegible to other healthcare workers, kills more than 7,000 people annually? This is an example of a prescription with illegible handwriting written by medical doctors. If you compare the previous prescription with this one, you can see the big difference. The current one is very easy to be read by other healthcare workers, especially the staff nurses and pharmacists. Okay, let's learn some examples from previous cases. Now, let's learn from previous cases and the implication of prescription error. A case of illegible handwriting of a doctor. A 42-year-old American was given a prescription by his doctor. The pharmacist issued Isodil, which he interpreted as Plendil as a result of illegible handwriting. So if you were the pharmacist, what would be your guess about the first prescribed drug? The second case is about Mr. W, who is given enalapril to control his hypertension. However, his potassium level is 5.7. So this is an example of an incorrect drug selection based on current condition of the patient. So this is a case of Mr. Y, who was admitted to the hospital with upper GI bleed. He was taking metoprolol 12.5 milligrams twice daily before the admission. But during admission, the medication orders indicated 15 milligrams twice daily. So this is an example of an incorrect drug dosage that has been written by prescriber. The fourth case is about Mrs. N, who is taking amlodipine 5 milligrams twice daily, but the ordering physician wrote as 5 milligrams OD. This is an example of an error in drug frequency. The fifth case is about Mr. B, who is admitted to the hospital due to recurrent presyncope episode. He has been on 12.5 microgram of digoxin daily prior admission. However, during admission, digoxin was not prescribed. Clearly, in this case, the error was deletion of previously used drugs. The sixth case is about Dr. A, who prescribed diclofenac sodium 75 milligrams to be given via intravenously instead of intramuscular injection to a patient. This is an example of an incorrect route of administration. Now let's learn the seventh case. This is about Dr. H, who started a patient on heparin infusion for deep vein thrombosis treatment. Dr. H only checks the APTT every other day despite knowing APTT is out of therapeutic range. This attitude is considered dangerous as it can jeopardize the patient's safety. The ninth case is about Mr. T, who was admitted to the hospital due to severe infection. During admission, he suddenly developed seizure after receiving imipenem and ganciclovir. The co-administration of imipenem and ganciclovir worsened the seizure episode. So this is an example of drug-drug interaction that a prescriber must consider prior writing a prescription to a patient. So this is another case of Dr. A, who wrote AZT on a prescription. So the nurse was wondering, did she mean zidovudine or azathioprine? Here is an example of confusion with abbreviation of the drug name. AZT can be zidovudine or azathioprine. So to avoid this confusion, you need to write the drug name in full and with correct spelling. Avoid abbreviation. Now, some errors occur during writing a drug dose with decimal point. Please remember to always use leading zero for decimal points, okay? In the case of digoxin, it should be written as 0.5 milligram instead of just writing 0.5 milligram. Okay, dear students, by now you should be able to understand the definition of prescribing errors, contributing factors to prescribing errors, and as well as all the examples of prescribing errors which could occur in clinical settings.